lovely people of Ghana. This is Bula Multimedia GH, and we are here to have a word with Dr. Reverend Samson Nawintoa about hepatitis and how it's rampant in Ghana. Good evening.
Good evening.
Nice meeting you.
Thank you so much.
Yeah. Please, we are here to have some questions with you about hepatitis and how it's rampant in Ghana.
Okay. Thank you so much for paying visit to my office this evening. Well, when we talk about hepatitis is a bacteria or a variable which is disturbing in this our country, not only in this our country, but the whole world. For example, when we ask about hepatitis, a person may ask, what is hepatitis? A white man will tell you that hepatitis is inflammation of liver tissues. And then hepatitis, we have 5 main types of hepatitis. We have hepatitis B, hepatitis C, hepatitis D, A, and E. Both A and E is through contaminated food. But hepatitis B, C, and D is through sexual infections. And hepatitis per se is something that kills a lot in this our country.
Okay.
Now you ask of hepatitis, what is hepatitis? The little thing I can tell you something about hepatitis being spread in this our country and even the nation is that hepatitis A and E is through contaminated food. A person may ask, what is contaminated food? For example, a person is selling a food without covering it. A person is selling a water, and then the person urinate without washing the hand. Use the same hand he used to urinate. Use the same hand and pick the pure water for you. You might have think that it is pure water, but it has contaminated. It is not more pure water again. A person is selling a food, flies, and then everything is flying all over. Dust and everything is all over. You might have think that once the food is palatable, is sweet, and people are buying, you are okay with it. But by then, you wouldn't know that you are buying sickness for yourself. Sometimes you go to some particular houses, they will finish cooking. And then when you see their cooking utensils, instead of them to wash them, keep them nicely, and then for the next cooking again, they won't wash them. They will just leave everything apart. And even sometimes some people will cook the food furnace, instead of covering the food, they will not cover it. They'll just leave the food. So all those things are something that we get it through contaminated. So we said hepatitis, we have A and E, and the E is through contaminated food. Now, sometimes too, you can also go to the market and buy something like carrot or cabbages. For example, a farmer may be farming carrot or cabbages or a vegetables. Where the person is getting the water from might have been a place whereby the water is running. And that running water may be carrying ladies' parts, their monthly things, and feces and all that things. The farmer may be fetching that water to spread on the cabbages and then the carrot. When it matured or germinate or ready to eat, the person will bring them to the market. He wouldn't know that it is poisonous or it is toxic to the body or to the immune system. Okay. Once the person is selling it, you might have think that you are buying something good, but you wouldn't know that you are buying sickness for yourself. Okay. So the hepatitis A and the E is through contaminated food. And that is how we can explain to you how food can be contaminated, how water can be contaminated. Now, when we talk about the B and the C, a person can get hepatitis B or hepatitis C through.
Doctor, thank you very much for your answers. Okay, we are okay, but we still need to get more about hepatitis. So if somebody asks, how does hepatitis B or C spread?
All right. Thank you so much, my dear wonderful lady, for asking me such a question. Also, we thank you so much for coming to my office, Bula Multimedia. We thank you so much, and may our Lord richly bless you. Now, if I want to begin how hepatitis spread, hepatitis have so many ways of spreading. It has so many ways of spreading. Now, hepatitis can be spread through sexual infection. Through sexual infection. It can be spread through a woman to a woman, or a man to a man, or anal sex, or deep kissing, or blood transfusion. Now, it's even haphazard to health workers. People who are laboratory technicians, they can easily get it. Why? Because if they are trying to pull the blood from the patient and mistakenly, if the needle fell down and maybe have some effect on the lady or on the person can easily get it. So that actually tells you that hepatitis have so many ways of spreading. Now, people who also doesn't have a station, like having numerous ladies, having an affair with this lady, having an affair with this lady, when he's seen any lady at all, even if he see a goat wearing a skirt, he will propose to the goat, provided the goat is a lady. Those people can easily get hepatitis. So hepatitis can be spread through numerous women, anal sex, and whatsoever. And also, hepatitis, you can also get it through childbirth. Let me say a woman is having it and a woman is having a pregnancy. It's very easy for the unborn baby to get it in the mother's womb. So this is how hepatitis can spread. And when we move on, about 7 years ago, that is on the year 2015, about peoples were about 257 million people were affected with hepatitis, and out of it 887 people died out of it. Currently, this year 2022, about 557 million people were infected with hepatitis, and out of it about 679 people die out of it. So hepatitis is something that spread in and day out, and it keep on spreading. For example, a person might have having a sweat, like you've entered into a car, you are wearing a short, let me say a short tee or a t-shirt, and then you are sweating, and I'm also sweating. Once there is sweat on my body, and there's also a sweat on your body, I can easily transfer it to you. Or I'm using a hanky, or I'm sweating, and you use your hanky and clean me. You might have think that you are doing a good thing, or you are being a good Samaritan. Once I have hepatitis, after cleaning me and also use the same hanky on your face, it's easily for you to contact it. So hepatitis, this is how hepatitis spreads all over. Thank you so much.
You're welcome. Thank you, doctor. Once again, I want to know about how the virus survive in external environment.
No problem. All right. Thank you so much. You asked me a question concerning about how do the bacteria survive in the external environment. Yes, the bacteria can survive in the external environment. Even, you see, the bacteria is very stubborn to the extent that when it falls on the ground, 7 days later, it can still affect you.
Wow.
It's very, very stubborn bacteria or virus. It can still affect you. So the bacteria is something that is very dangerous. And that is the reason why if a person is having it, if a person is having hepatitis B, he needs to treat it and treat it proper.
Okay.
Yes, he needs to treat it and treat it proper. Other than that, you can still have it. Thank you so much.
You're welcome. Once again, doctor, thank you very much for the answers. But maybe somebody may ask, how did this hepatitis symptoms looks like?
Lady, I think you asked a question concerned about how do the symptoms look like. In the first place, I let you understand that hepatitis is something that goes to the liver. It goes to the liver. I want to talk about hepatitis. It actually goes straight to the liver. And so when it goes to the liver, we have acute, we have chronic stage. Now, when it moves to that place, it begins to rotten the liver.
Okay.
So once it begins to rotten the liver, it is rotting small from the acute to the chronic. So from the acute side, the statistics and studies and research let us understand that The virus is something that their incubation is about 75 days. That is their incubation period, but can be verified from 180 to 30 days. So that means that after having this bacteria in your system, you can verify them from your system from 30 to 60 days or 180 days. And that is where you can know that I'm having hepatitis. Hepatitis is not a bacteria or a disease whereby you can just get it today and know that I have hepatitis in me. No. That means if you have hepatitis today, it can take you up to 6 months before you know that I have hepatitis. And that is when you go to lab or laboratory for maybe checkup. They will tell you that you have hepatitis. And by then, maybe the body antigens or maybe they may be replicative against the bacteria by then. That means the bacteria may be not something that can reproduce more, because we have red blood cells and then white blood cells in our system which are fighting against diseases. So by then they may be fighting against this. So the doctor may tell you that, oh, you have hepatitis, but it is not replicative. That means it cannot go beyond. So when you have hepatitis in you, like your question asks, how will I know that I have it? Once it is moving to, let's say, in the chronic stage, you begin to see that your urine become yellow. And normally you can see that your urine become yellow, and sometimes too you can see that your eyes too can also become yellow. Now you can have jaundice, the urine can be dark, and then you can also be vomiting, you can have abdominal pain. So it doesn't just mean that having a hepatitis you only see in your legs or maybe sometimes. No, it is when it moves to chronic stage, that is where you will see that your right ribs will begin to be having pains. And when you eat small, you see that you will have your stomach will be like, I'm certified, I'm full, but you are not full. When you wake up, you still see that your stomach is bloating. And then you begin to see that your heart, you're having a heart pain all over. And then your legs will begin to be swollen. So when you see that your legs are beginning swelling, that means that at that point, if God is not on your side, it's likely for you to die. For that one, I will say you will die. Because when you see your legs swelling and then your stomach bloating, from your face to the legs all over is swollen, then that tells, and your eyes is turning deep yellow, then it tells you that you are ready to die. So these are some of the symptoms that you know that hepatitis in a patient.
Thank you very much, doctor. Once again, I still have another question to ask.
Okay.
Maybe somebody will ask, oh, chronic infections and acute about hepatitis. What does it mean?
Okay. Thank you so much. Now, when we talk about chronic, a person having a chronic stage. Now, don't forget that I told you earlier that the bacteria is a bacteria that when it goes into your system, where it wants to be is in the liver. It starts in your liver because that is the softest place that it wanted to survive. So it will be eating your liver small. Now, in the acute stage, is whereby you do a test and find out that I'm having hepatitis. But when it moves to the chronic, that one, whether you do test or not, you can still know that I'm having hepatitis.
Okay.
Due to the studies people have been discussing on the radio and the television.
Okay.
Because by then, what will tell you that it has moved to what they call chronic is that your legs will be swollen. You can't eat. When you eat small, you are certified, and then your eyes become deep yellow. All your legs and your hand and the whole of your system become swollen. And then you yourself will feel that, I'm sick. By then, you can even use your hand and press your leg or your hand and you see that it will be going down. Okay. And that's what tells you that your death is near. So when we talk about, yes, a person who said that a good doctor doesn't speak that way. I know, in Ghanaians or Africans per se, we want vito. Okay. So chronic is whereby you are seeing that I'm getting deaf. But acute, let me ask something small about the acute. When we talk about the acute, it doesn't just mean that when a person has hepatitis, you are dying. No. Hepatitis, when you have it and it is in the acute stage, if the doctor accepts and fairly tells you that you are supposed to do this and do this and do this and do that, and you abide them or you go by it, statistics and research say that it may take you up to 5 years, and after the 5 years, it may reverse back to negative. Why? Because if the doctor tells you don't take this, don't take this, don't take this, and you abide them, it may help you. Maybe 5 years time, it will reverse back to negative. But it is not easy. Put that one in your head. It is not easy. Because how do you know whether I can be able to dodge the things? Because we have some particular food you are not supposed to eat. We have some particular drinks you are not supposed to take. Both orthodox medicine and then herbal medicine. Yes, both chemical and then herbal. It's not only herbal that you are not supposed to take some medicine. Now when you have hepatitis, there is some medicine in the herbal you are not supposed to take. And when you also have hepatitis, there is some medicine in the chemical you are not supposed to take. So if you didn't know them and the food and the rest, you can still cross your death line. So that is how it is. Thank you so much.
You're welcome. Once again, doctor, if somebody may ask, I have hepatitis, how do I manage it or how do I treat it?
Right. Thank you so much for this wonderful question. Hepatitis, don't forget that I told you earlier that hepatitis is a sickness that is rampant in the whole world. And even the white man himself have not been able to get hepatitis medicine. And I confirm to you, the white man himself have not been able to get medicine for hepatitis that can cure it. No. But he only get medicine that can manage it. But through research have been let us understand that herbal can be able to cure hepatitis. But not all herbal. Don't forget. Let's say a herbal that is in a research that have gone through Food and Drugs Board Authority. They will be able to investigate it. They will be able to send it into lab. For example, when you go to Rampant, we have herbal, scientific and then medical research. We have one there. When you send your medicine there, they will publish it. They will go to the lab and find out that whether that medicine can be able to cure hepatitis or not. Those are the medicine that can cure hepatitis. But not a person just going behind of his house, beginning to fetch leaves, come and boil them, filtrate them for you to take, and you think you are curing hepatitis. No. So we doesn't treat hepatitis anyhow. The way orthodox medicine or chemical medicine cannot treat hepatitis anyhow, the same thing herbal too cannot treat hepatitis anyhow. But I can boldly tell you that hepatitis is something that can be cured by herbal. Research have let us understand that if you have hepatitis and you rely on a good herbal, it will cure you. And for example, in this our particular office, we have cured so many people here. I quite remember the people we cured here, not 20, not 25, who we have cured them from positive to negative, not management. From positive to negative, not management. And we have our results. As you can see, our lab here, we have our results that when you come, we will remove them for you to confirm where the person were positive and where the person have run to negative. So my advice in that sector is that hepatitis can be cured by herbal, but not all herbal. Don't just go. So when you go to hospital, a medical doctor or medical assistant, that is MA, or medical doctor, or the midwife or a senior nurse will tell you that when you go home, don't take herbal. But he won't be able to get time and sit down and tell you that once I tell you don't take herbal, it is this reason or this reason that I tell you that don't take herbal. The categories or the difference in it is that it is not all herbal that you are supposed to take. Like I told you earlier. A person who is sitting in the house and said, oh, my father were doing it, my mother were doing, my grandfather were doing it, and he died and I inherited. No, we don't inherit treatment. You understand? Although your father and your mother were doing it, but you are supposed to also learn it. We've learned it from book, and we also have that idea that our father were doing it, that one is there, and we also learn it from book, and that one is also there. So we can be able to apply both book and what we also learn from our parents. So in that sector, what I will tell you is that if you go to hospital and a doctor tell you that don't take herbal medicine, don't deny him and don't also stop there. You can move ahead and see a medical or a good herbal office like my office. And that's why I can boldly tell you that when you come here with your hepatitis, you can be easily cured. So, thank you so much. And that is how I can explain to you.
I think I still have hope. And I know those who are suffering about hepatitis, they also have hope like I'm here. Okay, doctor, once again, can hepatitis cure?
Okay, I hope that should be my last question.
Yes.
Because I'm tired.
We are also running out of time.
Oh, okay. All right. So thank you so much, viewers. I thank your viewers so much. Beulah Multimedia, we thank you so much, and we are much grateful for coming to interview us, and for us also being part of your station. And we said, may our good Lord increase your viewers and your listeners. To answer your question, can hepatitis kill? The answer is yes. Hepatitis kills. Don't forget that I told you that on the year 2015, that is about 7 years ago, 257 million people were affected with hepatitis. Out of it, 887 people were dead. You understand? Yeah. So you can imagine who was affected and how were dead. And even this recent 2022, remember I told you how many people was affected and how many people were dead. So it tells you the hepatitis, it kills. It kills direct. And do you know why? It is a sickness that is a hidden sickness. When it comes to you, it doesn't kill, it doesn't show anything for you to know. You know, sometimes people are afraid of HIV. HIV is just a simple bacteria. Because HIV, when it gets you, it will only, when it is just that when you know that I have HIV, that's why you begin to get panic and then you grow lame. But when hepatitis is in you, you will not know because you are still having your normal body, your normal system. So you wouldn't go to hospital or maybe lab to check and find out what is happening to you. So before you realize, it has finished your liver. And once the liver is not there, you will die. Don't forget that in every human, liver, kidney, heart, these are the three things that hold human for you to be human. Without these three things, you can't live. And per se, the liver is very important. When the liver is not there, the heart cannot work. When the heart is not there, the liver cannot work. When the liver, the kidney is not there. So that means that both three of them are important. So when the liver rots, you will die. So hepatitis kills every day. It kills every day. So my advice to you is that if you have hepatitis and the doctor tells you that go home and sit down, relax. It won't kill you. There is no any good doctor that will tell you that you are about to die. When you send your patient to hospital, the doctor knows very well that in the next 30 minutes or next 30 minutes, your patient will die. Yet he will still prescribe medicine for you to buy. Yet he will still transfer you to a bigger hospital, whether Kolebu or maybe Tamale Teaching Hospital. But he knew very well that you would die. Why? Because we have signs and symptoms that shows that a patient will die. Maybe looking at the person's face will tell you, the ears will tell you, and even the hand, the hairs on the hands could tell you. So there are so many symptoms that the doctor knows that your patient will die. Yet he still asks you to transfer or prescribe medicine for you. So there is no any good doctor that will tell you that hepatitis will kill you. But he will rather tell you that, oh, it cannot do you anything. But use your brain. Use your brain. You will die. React into it. Right. So thank you so much.
You're welcome. Nice meeting you. We are very grateful. This is Beulah Multimedia GH. And we are so much happy about the words and the answers we've gotten from Reverend Dr. Samson Awentua. We are much grateful, and I am Abogore Naomi. Thank you very much for your time. Subscribe.